decision maker, do you get to decide what is done, or do you have to run everything through Chief of Staff Patel for his permission and the Secretary's permission?
So we'll let Tom take the first 7 of those. I'll take the last one. But I don't want to devolve this in briefing into just a transition briefing, because we do want to hit the COVID-related issues that are facing us as we approach Thanksgiving.
So I was raising my hand consistently, so I would think Mr. Muir probably doesn't mind answering all.
And I said we'll be happy to take the first. Tom will be happy to take the first 7 of those. So Tom.
So begin with the meetings. The agency review team obviously reached out last evening. We had our first discussions and exchanged electronic emails. First meeting today was by video teleconference, virtual. Good productive meeting as we kind of laid out sort of the ground rules. I can tell you that the team is willing and certainly able to abide by the COVID restrictions here in the Pentagon. They agree with the protection measures that we're doing for our families, our employees, ourselves, our colleagues, our comrades here in the Pentagon. They're looking forward to participating in discussions in the Pentagon. In fact, I'm providing a small tour on Monday next week for some of the agency review team leaders here in the Pentagon. There is dedicated office space for them in the Pentagon, in the reservation, here in the building actually, that we provided for them. It allows for social distancing for 6 feet between workspaces, to include video teleconference capacities at the unclassified side and at the classified side. As you discussed, there will be many that want updated intelligence briefings and updated briefings on operational plans. Many of those, once again, by statute. One of the many changes over the last 57 years of the Presidential Transition Act is to allow the Department of Justice and the Federal Bureau of Investigation to initiate background investigations and security clearances on many of the agency review team leaders. So many will come here with top secret clearances, investigated and adjudicated by the Department of Justice, reciprocated by the Department of Defense, which will allow them access to intelligence. They'll have access at the appropriate levels with signed non-disclosure agreements, because once again, the materials that they're going to review, once again, particularly if they're classified, many are not for public distribution or release, they'll be privy to and will respond to their queries, their questions, their requests for deeper dives, briefing materials, products, releases. In terms of the decision processes, we work in support of the Secretary of Defense for this operation. It is part of our alignment for professional, efficient, effective, and transparent with the agency review team process, and we're committed to doing that while executing our national defense strategy. So we have prepared for this for quite some time, for 6 months. We are prepared to receive the agency review team. I believe that some will work in the building. I think some will do virtual. Some of the members are not in the D.C. area. We think we'll be communicating with them via video teleconferences, either at the secure side or the unclassified side, if that's the dialogue that they want to get into. And we're committed to both supporting our statutory requirements and to continuing our mission here in the department.
All right. We'll go to Scott from Fed News Network.
You're not going to answer my question?
Oh, I thought he handled the.
My outstanding question is, what is the level of approval from Mr. Muir, and what does everything have to get the Chief of Staff Patel's approval, the Secretary's approval? At what level do decisions to share information or work with the transition team have to be approved by the Chief of Staff or the Secretary?
And I thought Tom's answered it there at the end there on saying that the goal here is to be professional, efficient, and transparent, and ensure that the team has the information that they need to be successful and ensure that our national security throughout this transition time is ensured. There will be decisions are going to be made on regard. I think there's some classification conversations that'll go into it, and I think part of it taken into account is the Secretary is in charge of the transition. I mean, the acting Secretary of Defense is in charge of this transition. Tom is going to be the career official handling it. He's been working very closely with the Deputy Secretary on this. I think, Tom, you said the Deputy Secretary has been ensuring that the workspace is correct and that the binders have been reviewed, is making sure that all has been done appropriately. I spoke with the Chief of Staff today, and he is assured me that Tom Muir is the lead on this, and that he's going to be working with Tom, and Tom is going to be the one working with the team today. The Chief of Staff reached out to the agency review team lead today as well to provide his contact information, let her know that if she needs anything, that she is welcome to reach out to him. His goal is to be the touch point for the Secretary and ensure the Secretary has insight into what's going on and to make sure that the transition is successful. Okay.
If I could just add in two quick thoughts of context. One is that we've been running a governance process in support of this, aligned with our policy for quite some time, as I mentioned. There's a senior steering group that meets monthly. In fact, we're probably going to increase that now that there's been an ascertainment, led by the deputy secretary and the vice chairman. So senior leadership in the department participates. I provide them updates every month about our current status of preparation, our plans, next steps, and the next meeting structures. We're also meeting with what we call the transition assistance coordinators. These are designated senior officials, general officers, and career senior executives in each of our cabinet agencies, each of our military departments, Joint Staff, National Guard Bureau, our Office of Secretary of Defense components. We meet weekly, just met Monday, and we discuss, and to include, the combatant commands as well, have a representative on this transition assistance coordinator process. We meet with them weekly, and we update them as to the status of both our plans, activities, next steps. There's where we're going to have the real discussion on deliverables, materials, next setup of meetings, scheduling senior leaders for interviews with the agency review team. We work these through our partners. So it's a collaborative governance structure underneath our policy structures.
All right. Let's go back to the phones. Scott from Fed News Network.
Yeah, good afternoon. So, the past few days, past week or so, we've seen really some of the largest numbers and spikes for service members being diagnosed with COVID-19. I'm curious, I realize that this is up to local commanders, but do you expect, I think you have about 60% that are open or don't have restrictions right now. Do you expect that number to go down as these cases continue to rise? And is the Defense Department as a whole considering any other sort of policies that might go in effect now that you have nearly 75,000 service members who have been diagnosed to date?
Scott, with the 60% number, what exactly are you referencing with that?
That would be the number of bases that are military installations that have eased their restrictions and gone green.
I'm not sure that number is exactly right. And if it was correct at some point in the recent past, I would expect that number, you're going to see an increase of facilities going to Charlie. I think the Navy has across the board has increased their level to Charlie. We've seen facilities. I think I mentioned Norfolk in the last week. Facilities in the Northeast. So I think you'll continue to see that. Once again, that's going to be decisions based on local communities and the operational needs of the services and the bases. So I think, yes, we will see those closures go up. Back to the question on generally, will there be any additional DoD measures put in place? We feel comfortable with the levels that we've put in place in the past, and that we have weathered this relatively well based on the guidance that was provided back in February of this year. As Ken pointed out, the number one priorities of the department were to protect our people and ensure we continue to do our missions. And so those guidance that has been pushed out by former Secretary Esper and the continuation through the Acting Secretary Miller has allowed the commanders to make decisions they need to protect their forces. So I don't see any blanket changes in policy that are being considered. I think we'll continue to watch and let commanders make the decisions on the ground. And then we'll do things like we're doing here today, is to reiterate to our forces and to double down and let them know that take these measures seriously. There's nothing wrong with commanders and everyone stepping up to restate the need to wear masks, to do social distancing, to wash hands, and to follow through with those mitigation measures. And then at the second part, we're going to look to support the Operation Warp Speed and vaccination efforts and hope to reach a point in the near future where vaccinations are out the door and people are being treated, and we start to see a different curve with respect to COVID. All right, we'll go to Nick from PBS. All right, not hearing Nick. We'll go to Jeff from Task and Purpose.
Thank you. Two quick questions. Will families and service members be required to get a COVID vaccine? And has Defense Secretary Miller responded to Bill Belichick's request that the U.S. confront Turkey and Azerbaijan over the war with Armenia?
Well, fortunately, I will say that there is a peace agreement in place right now between Azerbaijan and Armenia that appears to be holding at the current point. So we may be able to forestall having a summit between the acting secretary and Coach Belichick to discuss that. And then with regard to your first question, which I forgot already, please remind me, Jeff.
Sure. Will troops and families be required to get a COVID vaccine? Will it be mandatory?
I don't have information for you to share on that right now. I'm going to defer that, answering that question, to when we give the vaccination update in the coming weeks, and we'll have a fuller conversation about what will and will not be required. But at this time, Jeff, I'm not going to be able to share that. All right, we got a couple more. Megan.
Oh, Jeff took my question.
Okay, the Belichick question.
Yes, yeah,
Okay.
that's the one I've been holding on to
I
all
know.
week.
No, it didn't
actually,
have unidentified flag.
I do have a question. This was a little bit murky in your response to Tony and Aaron, but when was Acting Secretary Miller's last negative COVID test?
So we've kind of set the standard before that we're not going to get into every single negative test that a senior leader does. I can just say that in the time the secretary has been here, whether it's between testing prior to travel, testing as a result of the close contact that was reported, testing due to a White House meeting, he's been tested more than a half dozen times in the 2 weeks that he's been the Secretary of Defense, and I have no positive cases, no positive test results to report. All right, we'll go to the phones for the last one. Courtney Kuby.
My question was asked as well. Thanks.
All right. You have follow-up, Randy? All right.
Actually, do you have time for one COVID question?
Yes, Barb.
I would like to ask the doctor something. So can you, for people who work in this building, in the Pentagon, the issue of contact tracing is confusing to me, including reporters who work here. And I was wondering if you, or whoever the appropriate person is, I apologize if I'm asking.
Probably the best person.
Well, my question is really this. So somebody is tested and they come back positive, and you might say to them, so who have you been in contact with in the building in terms of contact tracing inside the Pentagon? Well, most reporters never hear of any cases of positive because we're not told of positive cases in this building. How can you advise the news media to ensure that they have full awareness of who may be tested, who may be positive, so we're not inadvertently being unknown spreaders, asymptomatic, anything like that? Nobody's ever really explained it to us, and this is the opportunity for us to ask. How do we learn more about what's going on inside the Pentagon?
Sure. From a Pentagon perspective, we do have a very robust contact tracing program. But you're right, though. It relies upon reporting, good, accurate reporting, that if I am sick and I tell my supervisor that I was tested in my local community and that I'm positive for COVID, then my supervisor would report that into our operations center here in the Pentagon, which rolls that up to Joint Staff. From there, within 24 hours, our policy right now is to contact the person who is reported to be positive and then ask them who they've been in close personal contact with, particularly during the time period that they were symptomatic. And you're right, there are many people that are asymptomatic, they're tested and then come positive. And so we look for 48 to 72 hours prior to their, and oftentimes there's a little bit of lag in terms of testing, right? You get tested, you find the results 2 or 3 days later. Hence, the CDC guidelines ask for 48 hours before they were symptomatic, shows an opportunity to spread the COVID virus inside the workplace. So then we ask them who has been in close personal contact for more than 15 minutes. Now it's over a 24-hour period, less than 6 feet, without a mask on or with a mask on, and we identify those people by name. What helps is when they maintain, where they understand who they've been in close personal contact with, and oftentimes in a building this size with nearly 11,000 in the workplace most days, it's hard to remember who you've been in close contact with. And so we ask them to give us the names of those they're in close contact with, and then within 48 hours, we're contacting those personnel and asking them if they're feeling symptomatic, are they feeling sick, do they have a fever, have they, anybody in their family feeling sick, have a fever, showing symptoms, and then we ask them to notify their local physician and get tested. Here in the building, about a third of our workforce are military, about a third of our workforce are civilian, and about a third of our workforce are contractors. And so it's kind of a mixed demographic, if you will, for healthcare provision. And so we're relying a lot on local healthcare authorities. And then all the numbers that are positive on the Pentagon Reservation we report up through public health authorities, so Arlington County, Alexandria County, Fairfax County, PG County, Montgomery County. They're aware of any outbreaks in here. We do not, by policy and by process, notify folks, hey, there's somebody in this cubicle that was positive. However, if you're notified by a contact tracer that says you may have been in contact with a certain person that was in the building next to you more than 15 minutes in a meeting with you, we'll advise that person to get tested. Right now, the CDC guidelines does not require testing for asymptomatic, but I'll ask Dr. Payne to kind of
No, you did a great job. Almost an honorary medical degree there, Tom. No, we would not necessarily test everybody who has a contact.
So, for example, Secretary Miller comes in contact with a Lithuanian minister who later tests positive. Secretary Miller tests negative. You have no reason to inform, to tell people, including reporters that may have been near Secretary Miller, that they need to be tested.
I would say, a test is a test only at that point in time, and that's why we also recommend quarantine or isolation for those contacts, because the disease could develop over time.
Nobody ever told you they're in contact with a reporter.
But let me because I think what Barbara's talking about is there's a chain. I think Tom hit on it there. It's contact, close contact is the CDC requirement, and then there's contact, and then there's contact with someone who had contact. And so the question you're asking is, why doesn't somebody tell you if you've been in contact with somebody who had a close contact?
I would like to ask that.
And I think that's not the guidance. That's not the CDC guidance. That the risk in that chain until someone is symptomatic or has tested positive, that chain is not there. And I would just say the other thing is Tom mentioned the process we have in place. I apologize. The bureaucratic process we have in place for notifying. But I think what you'll see, and people have seen the building, and is that there's the just general relationships of people in the building of if somebody tests positive, of reaching out to their coworkers and letting them know, reaching out to people that they have had close contact with immediately to let them know. I've seen that in cases recently where an individual may have tested positive, and they make it very clear because people want to know quickly, because the best way to stop the spread is to very quickly notify people. That's why we say if you have symptoms, don't come into work. Go see your doctor or your healthcare provider. The sooner the better, so that we can stop the spread. And so that we see that a lot happen in the building because we have a responsible workforce that understands the implications of having a number of tests here. So I'm just going to close up with a couple of final remarks, and then we'll let you guys out of this room. So I just want to share you, as I mentioned, we'll be back with some additional briefings on transition and on vaccinations in the coming weeks as more information becomes available. And so I'm sure Tom will be with us for that. And we'll have the appropriate people from DHA to come in and talk about the vaccination plan. So we've seen a lot of stories about the fact that with Thanksgiving, people aren't able to travel, people aren't able to be with families. And just a note of perspective for viewers and readers, and for those who are discouraged by not being able to travel this holiday due to COVID-19, and just ask you to remember that there are millions of military members who over the last 2 decades have missed many holidays in the service of the country, deployed across the globe in defense of the nation. This is not an ideal situation, but we're optimistic that with the progress of warp speed, the light is at the end of the tunnel. In closing, I want to reiterate why we're here, and that's to talk to our DoD personnel and our service members at home and abroad and encourage them to follow the CDC COVID-19 mitigation guidelines over these holidays. Take proper precautions with regard to necessary quarantines, wash your hands regularly, maintain social distancing, limit the size of gatherings, wear a mask, and if necessary, choose not to travel. And also, please make sure you observe local regulations. Finally, I just want everybody to remember that social distancing and hand washing are excellent excuses to get out of uncomfortable family conversations about politics at Thanksgiving. So just recommend everybody abuse those excuses often throughout the holiday season. And hope everybody has a good Thanksgiving. Thank you.
Happy Thanksgiving.